Hi, everyone. Welcome to Thanks for Sharing. I am your host, Jackie Pack, and today we're going to be stepping into a profession that quietly shapes our communities, helps us navigate crises, and advocates for those who need it most. I'm going to be talking about the history of social work, which is a profession that's as complex as the societies that it serves. I am a social worker, and while there are a couple of other routes to become a therapist, and there's also a lot of different things that social workers can do in addition to or instead of clinical work, I wanted to talk about the backstory of social work. March is Social Work Awareness Month, and I recognize it's only January, but I wanted to record a podcast about this. I've wanted to do this for a while, and I'm just going to do it now. So let's go back to the very beginning. Where did social work begin? What drove the pioneers of social work to dedicate their lives to helping others? And how has the role of social workers evolved to meet today's challenges? Now, whether you're a social worker or someone who has been helped by one, or you're just curious about social care and how it came to be, this episode is for you. So let's begin at the very beginning. To understand social work, we need to first look at how societies historically cared for their vulnerable populations. For much of history, caring for the poor, sick, and marginalized was the responsibility of families, religious institutions, and charities. This was particularly the case in Europe during the Middle Ages, with churches taking the lead through charity and almsgiving. But the Industrial Revolution in the 18th and 19th centuries changed everything. As societies moved from rural to urban, people migrated to crowded cities for work, often living in poverty-stricken slums. Families were fragmented, and communities were overwhelmed, and the church alone couldn't meet the growing need. Poverty became not just an individual issue, but a structural one, and this laid the groundwork for modern social work. One of the first significant frameworks to address this was the English Poor Laws, enacted as early as the 16th century. These laws introduced indoor relief like poorhouses and outdoor relief, which gave assistance directly to families. And while groundbreaking, the Poor Laws carried a moral stigma, tying poverty to laziness and perpetuating shame for those in need. It was in this setting, which was a time of rapid industrialization, migration, and growing inequality, that the seeds of modern social work were planted. By the late 19th century, two key movements emerged that shaped the profession of social work. The first one, called the Charity Organization Societies, or COS, and the second one was the Settlement House movement. The Charity Organization Societies, first founded in 1869 in England, aimed to bring scientific methods to charity work. Leaders of the charity organization societies believed that individual moral failings caused poverty. So their work focused more like what we would call casework today, which was helping individuals become self-sufficient through moral guidance and resources. While their approach often lacked an understanding of systemic inequity, the charity organization societies introduced foundational practices like home visits and personalized assistance that social workers still use today. Now, on the other side was the Settlement House movement, which took a more progressive and community-focused approach. Settlement houses such as Jane Addams' Hull House in Chicago were established in urban slums to address the root causes of poverty, which they identified as a lack of education, poor housing, and unsafe working conditions. Jane Addams and other settlement workers lived alongside the people they served, creating schools, public kitchens, and cultural programs. They didn't just treat symptoms of poverty. They advocated for labor laws, public health reforms, and immigrant rights. These two movements, the individualized focus of the charity organization societies and the systemic focus of settlement houses, laid the foundations for modern social work. And they sparked an ongoing debate. Should social workers focus on individual change or systemic reform. As we entered the 20th century, social work began to professionalize. In 1898, the first formal social work training program was created at the New York School of Philanthropy, which would later become Columbia University's School of Social Work. And around the same time, social work began to spread internationally with pioneers like Octavia Hill in the UK and the expansion of settlement houses in Europe and the United States. The World Wars and the Great Depression were pivotal periods for social work. During World War I, social workers supported returning soldiers and families dealing with grief and trauma. The 1930s brought the New Deal, where social workers like Frances Perkins helped shape landmark policies like Social Security. Social work's role continued to expand in the post-war era, addressing issues of mental health, civil rights, and family welfare. By the 1960s, the National Association of Social Workers, also known as NASW, was formed, uniting the profession and establishing ethical guidelines that still govern social work today. But again, here's the critical question. What is the role of a social worker in a changing world? One pivotal moment that shaped the direction of social work as a profession was the tragic Triangle Shirtwaist Factory fire in New York City in 1911. This horrific event occurred when a fire broke out in a garment factory where hundreds of women and children, mostly immigrant workers, were locked inside to prevent theft and unauthorized breaks. With no way to escape, many workers jumped from windows to their deaths. The fire claimed the lives of 146 workers, and it shocked the nation. This tragedy highlighted the dangerous and exploitative conditions faced by workers in industrial America. It spurred a wave of activism and reform, with social workers playing a key role in advocating for worker protections and systemic change. Figures like Jane Addams and other social reformers collaborated with labor unions to push for workplace safety laws, for child labor protections, and fair treatment of workers. The Triangle Shirtwaist Factory fire underscored the importance of addressing systemic issues, which is the cornerstone of macro-level social work today. It also showed the power of social work as a force for societal change, connecting individual suffering to structural inequities that require collective action. Social workers often focus on dual roles and work on two levels, helping individuals navigate the systems they're trapped in while simultaneously working to change those systems. An example of this would be a social worker who helps a single mother access food stamps, but also advocates for policy changes to address root causes of food insecurity, wage stagnation, and lack of affordable childcare. Let's talk for a minute here about what exactly I'm talking about when I talk about systemic issues. And I'll give a few examples to help clarify what this looks like. So if we're looking at a definition of systemic issues are problems that arise from the structures, policies, and norms of institutions or societies. They are deeply embedded in the fabric of systems like education, healthcare, government, and employment. And they disproportionately impact certain groups of people over others. These issues persist across generations, often perpetuated by historical, cultural, or economic factors. In the early 20th century, children as young as 5 worked long hours in factories under dangerous conditions. This wasn't the result of one bad employer. It was a societal norm, rooted in economic systems prioritizing profit over human welfare and exploiting the most vulnerable. Social workers like Jane Addams didn't just help individual children. They fought to change the laws and structures that allowed this exploitation. So anytime we're looking at systemic issues, there are key characteristics of systemic issues. There's 4 key characteristics. The first one is institutionalization, meaning it's rooted in the laws, policies, or organizational norms. Another way of looking at that is to say it's just the status quo. It's how things are done. Even if it's not fair, even if it's exploitive, even if it causes harm. The second key characteristic of systemic issues is that there's a widespread impact, and it affects large groups rather than just isolated individuals. The third key characteristic is an interconnectedness, meaning it's often tied to other systems. So let me give you an example of this to help you understand. Systemic racism in education is going to impact job opportunities and employment. A systemic issue in one area leads to a systemic issue in another area. And the fourth would be a resistance to change. It's really hard to dismantle systemic issues without structural reforms because they are self-reinforcing. And those who benefit from the systemic issues often feel threatened by even the talk of change. Those who benefit from the systemic issues feel that they deserve the privileges that are granted to them by the systemic issues. And to take that away and give it to somebody less deserving would be wrong. It would be immoral. So let's look at some of these systemic issues that we see currently in our modern world. Systemic racism refers to how societal structures like laws, policies, and institutions create and perpetuate inequality based on race. It's not just about individual prejudices. It's also embedded in our systems. So we'll see examples in criminal justice where there is a disproportionate incarceration rate for Black and Indigenous individuals. We'll see it in education, where underfunding of schools in predominantly Black or Latino neighborhoods is commonplace. And we see it in housing, with redlining policies that segregate communities and restrict home ownership opportunities for minorities. Let's look at the historical context that led to systemic racism in America. So we have to go back to slavery, which roughly started in 1619 and continued through 1865, where enslaved Africans were brought to the United States and forced to work without pay, creating a massive wealth gap between white Americans and Black Americans. This wealth gap was compounded over generations as enslaved people were denied the ability to own property or build generational wealth. Laws like the Fugitive Slave Act reinforced the systemic nature of racism, treating Black people as property and embedding racial hierarchies into law. After slavery, we had the Reconstruction period and Jim Crow laws. This spans from 1865 to 1965. After slavery was abolished, Black codes were introduced to restrict the freedoms of formerly enslaved people. In the Jim Crow era, which was from 1877 to 1965, codified segregation in housing, education, public facilities, and employment. For example, schools for Black children were underfunded and inferior, which reinforced inequality. And there were also voter suppression tactics, such as literacy tests and poll taxes that kept Black Americans politically disenfranchised. In the 1930s to the 1970s, there were discriminatory housing policies. The Federal Housing Administration, or the FHA, used redlining, which allowed them to deny loans to Black families or those living in predominantly Black neighborhoods, making it nearly impossible for them to buy homes or to build wealth. Suburban developments like Levittown explicitly excluded Black buyers, while white families benefited from appreciating property values. And then from the 1970s to the present, we see mass incarceration stemming from the war on drugs. Policies like mandatory minimum sentencing and 3 strike laws disproportionately targeted Black communities. The war on drugs criminalized minor drug offenses, leading to skyrocketing incarceration rates for Black individuals, which disrupted families and perpetuated poverty. Let's look at a few examples of systemic racism in practice. Let's look at income gaps. Historically, Black Americans were excluded from wealth-building opportunities, such as the GI Bill, post-World War II, which disproportionately benefited white veterans through access to education, jobs, and home loans. Current disparities in 2020, the median wealth of white households was $188,000 compared to $24,000 for Black households. This wealth gap limits access to higher education, home ownership, and business opportunities. When the Supreme Court in 2024 was looking at affirmative action, many people claimed that systemic racism was no longer a problem. But affirmative action policies were the very reason that many people coming from Black households, Latino households, where this wealth gap really limited their access to higher education, allowed them to go to universities and to start having access to education that allowed them to have a better career, making more money, and starting to build generational wealth. There's racial disparities in healthcare. Black women are nearly 3 times more likely to die from pregnancy-related causes than white women. This is partly due to systemic biases in healthcare and a lack of access to quality care. Black Americans have shorter life expectancies compared to white Americans, partly due to systemic barriers to healthcare. Also exposure to environmental hazards and economic disadvantages. Then we take the Tuskegee syphilis study, which started in 1932 and ended in 1972. And this exemplified institutional racism where Black men were intentionally left untreated for syphilis without their knowledge or consent. And this eroded trust in healthcare systems. I talked about school inequality. Schools in predominantly Black and Latino neighborhoods are often funded by local property taxes, which are lower due to historical redlining and lower home values. This results in fewer resources, outdated textbooks, and overcrowded. Despite the 1954 Brown v. Board of Education ruling, schools remain segregated due to residential patterns shaped by historical redlining. For example, a 2019 study found that Black students attend schools that receive $23 billion less in funding annually compared to white majority schools. When we look at cycles of poverty, we see underfunded schools leading to lower educational attainment, which limits job opportunities and perpetuates poverty. A lack of wealth means that Black families cannot afford to invest in higher education or buy homes, furthering the cycle of economic disparity. And then discrimination in hiring practices and occupational segregation means Black workers are often relegated to lower paying, less stable jobs. If we connect it all, let's look at how systemic racism reinforces inequality. I'm going to give you an example. Let's say there's a Black family in a historically redlined neighborhood, sends their children to underfunded schools. Without access to quality education, these children are less likely to attend college or secure high-paying jobs, which perpetuates economic hardship. Example number 2, a Black individual experiences healthcare discrimination, leading to poor health outcomes. And this can reduce their ability to work consistently and worsen their financial situation. Example number 3, a parent incarcerated for minor drug offenses disrupts family stability, disrupts family financial situations, leaving children to grow up both in poverty and limiting their opportunities. Another area where systemic issues are prevalent is with gender. Gender inequality is the systemic disparity in opportunities, rights, and representation between genders. It manifests in power imbalances, societal expectations, and economic disadvantages. Again, let's look at gender inequality in the workplace. So when it comes to the gender pay gap, here are the facts. Women in the U.S. earn approximately 84 cents for every dollar earned by men in 2023. And the gap is wider for women of color. Black women earned 67 cents to the dollar, and Latino women earned 57 cents for every dollar earned by a white man. This disparity results from a combination of factors, including occupational segregation, meaning that women are concentrated in lower paying jobs, societal undervaluation of traditionally feminine roles, meaning caregiving, which is not paid for, not really considered something of value that should be paid for, and then discrimination in hiring and promotions. For example, a male and female employee performing the same role with the same qualifications may have different salaries because of biases in negotiations or assumptions about their commitment to the job. Maybe women are perceived as being more likely to have to take maternity leave, or women are perceived as being more likely to have to take time off for a sick child. Inequality in gender also shows up with underrepresentation in leadership. As of 2023, women hold only 10% of CEO roles in Fortune 500 companies, despite making up nearly half the workforce. This glass ceiling is maintained by structural barriers such as unequal access to mentorship, biased performance evaluations, and expectations that women balance work with caregiving. For example, a woman might be overlooked for a promotion because the decision makers perceive her as less decisive, or they assume she prioritizes family care over her career. We also see this when it comes to reproductive rights. The facts are that in some states and countries, restrictive laws limit access to abortion, birth control, and comprehensive sex education. For example, in the US, after the Dobbs v. Jackson Women's Health Organization decision in 2022, many states had laws waiting for this that would ban or severely restrict abortion. These restrictions disproportionately impact low-income women and women of color, who may lack the financial resources or ability to travel to access care. We've had several stories since Dobbs where women in a state with an abortion ban may be forced to carry a non-viable pregnancy to term, risking her physical and mental health. Even in places where abortion is legal, societal stigma and healthcare provider biases can limit access. Additionally, women may face forced sterilizations or contraceptive use, especially in marginalized communities. During the 1970s, as part of a discriminatory population control practice, Indigenous women in the United States were subjected to forced sterilizations. We see gender inequality show up in gender-based violence. When it comes to domestic violence, globally, 1 in 3 women experiences physical or sexual violence in her lifetime, often from an intimate partner. A woman experiencing domestic violence may not be able to leave due to financial dependence, societal judgment, a lack of access to shelters, or the fact that when she is leaving, the threat to her life increases. Sexual harassment in workplaces. The studies show that 1 in 4 women have experienced sexual harassment, creating hostile environments that discourage women from advancing in their careers. So, for example, a female employee might be overlooked for opportunities because speaking out against harassment could label her as difficult or uncooperative. I've worked with women where this happens, where there is sexual harassment in their workplace, and they do get punished. I think one of the reasons for this punishment is if that woman got promoted, if that woman started climbing the ladder because of her work performance and her dedication to her career, there's a fear that if she accesses more power, she might be able to do something about the sexual harassment she experienced. So keeping her in lower roles, not allowing her to advance, keeps the perpetrator safe. And then if we talk about femicide, in some countries, the killing of women because of their gender is a growing epidemic. For example, in Mexico, 10 women are killed daily, with many crimes going unpunished due to weak legal systems and cultural impunity. When we look at the explanation for gender inequality, it's obvious there's a link to patriarchy. Patriarchy is a social system where men hold power and dominate in roles of political leadership, moral authority, and control over property. And yes, maybe they don't have that power over all men, or not all men have that access to power. But another way of describing patriarchy is that males dominate some other males and all females. If we put it in a historical context, women were legally considered property in many societies with no rights to vote, to own property, or to work outside the home. Even after gaining legal rights, cultural and institutional systems designed by and for men continue to favor male dominance. In the workplace, patriarchal ideas reinforce the stereotype that men are natural leaders, while women are better suited for caregiving roles. Gender inequality often manifests in everyday scenarios that feel normal, but reflect systemic biases. Globally, women perform 75% of unpaid care work, which includes childcare, elder care, and household tasks. A working mother often comes home to a second shift where she's expected to handle most household responsibilities leaving her less time to pursue career advancement or self-care. You see this in the workplace where women are interrupted or spoken over in meetings, reinforcing the perception that her contributions are less valuable than her male colleagues. While progress has been made, systemic barriers still limit gender equality. Women gained the right to vote, the U.S. 19th Amendment in 1920. Laws like the Equal Pay Act of 1963 aim to close wage gaps. Movements like Me Too have spotlighted sexual harassment and empowered women to demand accountability. Despite these advances, cultural norms and institutional biases persist. Parental leave policies often assume women are the primary caregivers, discouraging fathers from taking leave and reinforcing these gender roles. And then we have laws that were never renewed or strengthened. The Paycheck Fairness Act. This proposed law aimed to strengthen the Equal Pay Act by prohibiting employers from retaliating against employees who discuss wages and requiring employers to prove that pay disparities are performance-related. The Paycheck Fairness Act has been repeatedly introduced in Congress, but has not been passed into law. The U.S. does not guarantee universal paid maternity or family leave either. While the Family and Medical Leave Act, or more commonly known as FMLA, does provide unpaid leave, it does not cover all workers, disproportionately impacting women in low-income jobs. Efforts to expand paid leave at the federal level have stalled. And then let's look at state-level protections that have ended. Reproductive rights and workplace protections. In states where abortion restrictions have been implemented, women face additional barriers in the workplace, such as limited access to abortion-related health care coverage through employer-provided insurance. Some state-level efforts to enforce stricter equal pay laws have been repealed or weakened due to political changes. For example, state-specific pay transparency laws often face resistance and may not be renewed. And there's other challenges to employment rights. Women, especially single mothers, are disproportionately represented in gig and contract work, which often lacks employment protections like maternity leave or health benefits. These jobs fall outside the scope of traditional labor laws, leaving women vulnerable. And temporary increases in federal child care subsidies during the COVID-19 pandemic expired in 2023, forcing many women out of the workforce due to the rising cost of childcare. While most core federal laws protecting women's employment rights remain in place, temporary protections have expired, and progress towards stronger protections have often stalled. Additionally, state-level restrictions and gaps in enforcement create vulnerabilities for many women. These examples matter because by linking historical systems like patriarchy to our modern challenges and everyday impacts, and showing progress alongside barriers, these explanations create a nuanced understanding of gender inequality. This framework helps make systemic issues relatable, actionable, and accessible to a broad audience. Let's look at systemic inequality for LGBTQ+ people. Systemic inequality for LGBTQ+ individuals involves societal, institutional, and legal structures that marginalize people based on sexual orientation or gender identity. In many countries, there are no comprehensive laws protecting LGBTQ+ individuals from discrimination in employment, housing, education, or public accommodations. For example, the United States, before the Supreme Court ruling in Bose v. Clayton County in 2020, LGBTQ+ workers were not explicitly protected under federal anti-discrimination laws. Even now, there are gaps in protections, such as for housing or public services in some states. In 70+ other countries, homosexuality is still criminalized. And in some, like Saudi Arabia, it is punishable by death. In the United States, a transgender person in a state without anti-discrimination laws can legally be denied housing or evicted solely based on their gender identity. In countries lacking comprehensive healthcare laws, insurance plans may refuse to cover gender-affirming surgeries, hormone therapy, or mental health care for LGBTQ+ individuals, leaving a trans person forced to pay out of pocket for essential medical care, which further marginalizes them economically. Many transgender individuals face long wait times, high costs, and outright bans on gender-affirming treatment. Some U.S. states, like Florida and Texas, have recently implemented bans on gender-affirming care for minors, leaving young trans people without access to puberty blockers or hormone therapy. So a teenager in a state with this restrictive law might experience worsening mental health because they are unable to access the care they need. LGBTQ plus youth experience disproportionately high rates of mental health challenges due to the stigma and rejection. Nearly 40% of LGBTQ plus youth report seriously considering suicide in 2022, according to the Trevor Project. A queer youth in a rural area might struggle to find a therapist who is LGBTQ affirming, which compounds their feelings of isolation. There's also higher rates of violence for transgender individuals, especially trans women of color. In 2021, at least 57 trans individuals were killed in the US, with Black trans women being the most frequent victims. A trans woman might avoid public spaces or avoid using public restrooms out of fear for her safety, limiting her ability to participate fully in society. LGBTQ plus youth often experience bullying and harassment at significantly higher rates than their peers. GLSEN reports that 59% of LGBTQ plus students feel unsafe at school because of their sexual orientation. A gay high school student might drop out due to relentless bullying, perpetuating these cycles of economic and social marginalization. The absence of laws protecting LGBTQ plus individuals varies by location in the United States and creates unequal experiences. In some US states, conversion therapy for LGBTQ plus youth is banned, while in others, it is still legal, perpetuating harm. LGBTQ plus individuals are often rejected by family members or communities, leading to higher rates of homelessness and poverty. Nearly 40% of homeless youth in the US identify as LGBTQ plus, often because they are rejected by their families. LGBTQ plus individuals often experience significantly higher rates of anxiety, depression, and suicide. How do we talk about systemic issues in a way that can make a difference or lead to a productive conversation? Now, we can only control one side of that conversation, which is the side we are engaging in. So these are helpful tips to keep in mind if you're going to engage with others in conversations about systemic issues. Avoid blaming individuals. Focus instead on the systemic roots of inequality, such as laws, institutions, and cultural norms, rather than placing blame on specific people. Explain that discrimination isn't just about individual prejudice, it's also about legal systems that fail to protect marginalized groups. Use analogies. Compare systemic issues to relatable challenges to clarify how deeply embedded the problems are. For example, a system that lacks LGBTQ plus protections. You could compare that to a leaky pipe that requires structural repairs. And quick fixes like patchwork policies are not going to address the root causes. Highlight intersectionality. Show how systemic issues overlap and compound for individuals with multiple marginalized identities. A Black trans woman may face racism, sexism, and transphobia, simultaneously creating unique challenges that can't be addressed in isolation. And focus on solutions. Emphasize that systemic issues require policy reform, education, and cultural shifts to create lasting change. For example, you might discuss how inclusive education and anti-discrimination laws can improve conditions for LGBTQ plus individuals over time. Framing systemic issues like legal discrimination, barriers to healthcare, and violence against LGBTQ plus communities requires a combination of data, stories, and accessible explanation. So that's my getting off topic and talking about systemic issues, and hopefully that helps you understand more about systemic issues. Now I want to pivot back and talk about systemic issues in social work, which is the topic of the podcast. As I was stating, in the earliest 20th century, social workers like Jane Addams encountered systemic issues in the form of unsafe labor conditions and urban poverty. Addams and her colleagues at Hull House didn't just offer food and shelter, they also fought for child labor laws, safer working conditions, and public education reform. They understood that while individual support was necessary, real change required addressing the systems creating poverty in the first place. These are just a few examples of systemic issues. a problem that's baked into the way our society operates. But what does that mean and how do we change it? When Jane Addams and others pushed for labor reforms, they weren't just helping individuals. They were dismantling systems that allowed child labor and unsafe working conditions. And the result? Laws that protect workers to this day. Well, except in Arkansas. In 2023, Arkansas enacted legislation that rolled back certain child labor protections. Governor Sarah Huckabee Sanders signed the Youth Hiring Act of 2023, which removed the requirement for children under 16 to obtain an employment certificate before starting work. Previously, these certificates verified the child's age, described the work they would undertake, and provided proof of parental consent. Proponents of the law argue that it streamlines the hiring process and reduces bureaucratic hurdles and reduces bureaucratic. However, critics express concern that eliminating these safeguards will increase the risk of exploitation and unsafe working conditions for minors, as we used to do in this country. Notably, this change came amid a reported rise in child labor violations in Arkansas. And instead of addressing that issue, they just looked for ways of making that legal. Between fiscal years 2020 and 2023, the state experienced a 266% increase in such violations, with cases rising from 460 to 1,685. This legislative change aligns with a broader national trend, where several states have moved to relax child labor regulations. Advocates for these rollbacks often cite the need to address labor shortages and provide employment opportunities for youth. Opponents warn that weakening child labor laws could undermine decades of progress in protecting vulnerable young workers from exploitation and hazardous work environments. As the field of social work continued to grow and evolve, new disciplines emerged to address specific needs in mental health and relational care. Two of the most prominent are marriage and family therapy, also known as MFT, and clinical mental health counseling, CMHC, and LCPC, which that license is in some states. It used to be here in Utah, licensed professional counselor. And I don't recall the year where all LPC licenses or degrees were then rolled under the CMHC, which is a clinical mental health counselor license. These degrees emerged in the mid-20th century as specialized approaches to mental health care, adding new dimensions to the helping professionals. Marriage and family therapy focuses on systems thinking and relational dynamics. Unlike traditional social work, which often centers on the individual within broader social systems, MFT emphasizes how family systems influence behavior, communication, and mental health. It addresses issues like marital conflict, parent-child relationships, and family trauma, offering a unique perspective that complements social work's broader scope. Clinical mental health counseling, on the other hand, emerged as a specialized field focused on addressing individual mental health issues through therapeutic techniques. CMHCs are trained in areas like trauma, substance abuse, anxiety, and depression, often working in private practice or clinical settings. Like I said earlier, social workers can combine therapy with case management and advocacy, and other social workers, like clinical mental health counselors, are more narrowly focused on providing therapy and mental health support. And to be clear, all of these degrees, while they might have their individual unique area of focus, they've all added to each other. So if you're in a social work program, it's not like you're not going to be exposed to issues of family conflict or couples work. Likewise, in CMHC, you still may be taught how to address policy issues in addition to working and focusing on the individual. The emergence of these additional degrees reflect a growing recognition of the complexity of human needs. Social work, MFT, and CMHC overlap in many areas, particularly in mental health, but also they each bring unique strengths to the table. Social workers often take a more holistic approach, addressing not just mental health, but also housing, employment, and systemic barriers. MFTs excel in addressing relational dynamics, while CMHCs offer deep expertise in individual therapy. Together, these disciplines have expanded the helping professions, ensuring that clients receive care tailored to their unique needs. One thing I want to specify, and I tell people who, sometimes I'll get phone calls, sometimes our office gets phone calls, or sometimes I'll directly get a phone call from somebody who's looking to go into one of these fields. And one of the things I tell them is that the graduate program is going to give you an understanding of theories and approaches to different mental health issues, as well as getting familiar with diagnoses, best practice, and ethics. As long as the program is accredited, it's going to be a good program. And then once you graduate, your degree opens up a lot of various trainings and certifications that you can pursue as you specialize or get trained in the area you want to focus on, regardless of what your degree is in. Today, social workers are everywhere. They're in hospitals, schools, mental health clinics, community centers, and government offices. And they wear many hats: therapist, advocate, policymaker, crisis responder, and community organizer. Social workers address some of the most pressing issues of our time: poverty, mental health crisis, homelessness, systemic racism, child welfare, and refugee support. They are often first responders to disasters, whether natural or human-made. Social work operates at 3 critical levels: micro, meso, and macro. At the micro level, social workers focus on individuals and families. This is where direct practice happens: counseling clients, providing mental health support, and helping individuals navigate complex systems like healthcare or foster care. Micro level work addresses personal challenges like trauma, addiction, and family dynamic. At the meso level, social workers engage with groups, organizations, and communities. This could mean facilitating support groups, therapy groups, creating community programs, or improving the policies within schools, hospitals, or agencies. Meso work bridges the gap between individual needs and the larger systems that serve them. And then finally, at the macro level, social workers look at society as a whole, focusing on systemic change. This includes policy advocacy, legislative work, and organizing efforts to tackle issues like poverty, healthcare access, and social justice. Macro-level social work addresses the root causes of societal problems, seeking to create sustainable change through laws, policies, and systemic reforms. By working at all 3 levels, micro, meso, and macro, social workers ensure that individuals are supported, communities are strengthened, and systems are made more just and equitable. Yet they face challenges: high caseloads, burnout, limited funding. Despite this, many social workers remain on the front lines, committed to the profession's values of service, social justice, dignity, and respect for every individual. I've mentioned before, and I did a podcast episode with my brother, who was a U.S. congressman. And when he won the first time, he went to the orientation for the newcoming House members. And in that year, 2018, there were quite a few females who had won, younger females. That's when AOC won. That's when Omar won. It was a large group of progressive, liberal young women who had won seats in the House. And so they're at their congressional orientation, and it was recommended. He said he had mostly filled positions for his congressional staff at that point, but was sitting in a conversation where they were talking about if you still have spaces to fill in your congressional staff. He told me, he said they were like, oh my gosh, hire MSWs. They're amazing. Their understanding of what we're trying to do at this level. If you don't have an MSW on your congressional staff, try to get one. Which I just thought was a story that when my brother told me about it, it made me smile. It's important to recognize the humanity in this work. Social workers are people who choose to sit with others, often in their darkest moments. They believe in change, not just for individuals, but for systems, institutions, and for society itself. From the English poor laws to the settlement houses to today's global challenges, social work has evolved alongside society and often led the way toward progress. As I wrap up today's episode, I invite you to think about this. What does it mean to care for the vulnerable in our communities? What does it mean as a society when we care for the vulnerable versus villainizing, dehumanizing, or othering the vulnerable? And how can we as individuals support the systems and people who do this work every day? At the end of this episode, I want to remind you that your story matters. Remember, there's something meaningful in every chapter. Don't wait to share your story until it's finished. Until next time, Jackie. Leave